Hi, I'm Katie Crane, and this is the Pilates Lounge. Hey there, my movement-loving friends. My name's Katie Crane. I'm the Pilates professional, and this is the Pilates Lounge. Thank you so much for joining me. I'm thrilled that you are here. Now, before we get started today, just a reminder that we now have the Pilates Muse publication coming out every 2 weeks for you. So if you haven't yet joined the publication, then do so in the show notes. The idea is that there are articles associated with or married to these podcast episodes. I believe that not only can a podcast be a powerful way for us to share information and learn? But when we look at things in writing, when we are actively reading things, then we're much better at remembering and conserving that information that we're taking in. So be sure to join the Pilates Muse. But apart from that, let's get started. Have you ever looked at a client in the studio who just seems to be able to, in inverted commas, move so effortlessly? And then you look across the room and there's somebody else trying to perform exactly the same exercise, and they just look like they are struggling so much. There's no doubt about it that the body comes in many shapes and forms, many sizes, and we all have a really individual understanding of movement when it comes to Pilates. In fact, I often look around the room and imagine that in each person's head, it's like they're singing their own song and they're just moving to their own tune, despite what I'm explaining or trying to get them to perform. There's always a couple of people in the room that are doing things just as I have asked, but those people normally have been coming for a while. And the rest of the mob are literally just singing along in their head, doing whatever it is that they think they should be doing. Well, one part of our learning is done through what's called proprioceptors and interoceptors. But there's a classification of people who really don't have the feedback both internally inside their body and externally from their surroundings to really know and be able to feel whether or not what they're doing is right and whether or not the muscles that we want them to be feeling are even doing their job. We've probably all seen in that studio environment people who are very mobile. So we might call that hypermobile. So hyper, Hyper, is when you have too much of something. So hypermobility, you have too much mobility. And sometimes that hypermobility, too much mobility, can be in the joints. Normally it's from stretching ligaments and tendons too much. Sometimes it can be the muscles that are very hypermobile. But there is an extreme type of hypermobility actually called hypermobile syndrome, which can be very, very painful. There's also another syndrome called Ehlers-Danlos Syndrome. So these two are the extreme cases of the hypermobile client. And it's really important that we understand as Pilates professionals how to identify when somebody is excessively pushing into a joint and probably stretching ligaments, and how we can work with people with Ehlers-Danlos. Also, I'm just going to call that EDS throughout the podcast, or HSD, hypermobile syndrome, because people at this extreme spectrum, they actually end up living in a lot of pain, discomfort, and one part of their experience is that they're not getting feedback from their surroundings. So they're not getting feedback through the body to understand where they are in space. So we would see that in the studio. And there's ways that we can really help these people connect with their body, which in turn can help reduce pain and improve function. So EDS and HSD is not just the normal hypermobility that we might see. And when I talk about hypermobility, let me give you an example, because I see this all the time in class and we spend a lot of time helping people correct these things. Let's take, for example, you're teaching a plank exercise. So maybe you've got your students on the reformer, you've got the foot bar down and their hands are on the foot pad and their feet are on the carriage and you've got them in a plank position. Now, when you look at their elbows, so their hands are flat on that foot pad, when you look at their elbows, if they're hypermobile in that joint, then the inside of their elbow will be facing forwards and their arm will be completely straight. But get this, I want you to do this right now with me so that you understand. I don't want you to do a plank, but I do invite you to put your arms out in front of you. So straighten your arms in front of you. Have your palms flat. So imagine that your palms are flat up against a wall. And I want you to have a look on the inside of the elbow joint. That should be a small concave. If in your body that is either completely flat or if it has a bump in it that's poking out, then you are hypermobile in that joint. Now, when we go ahead and put load on that, so you put your whole body weight on that, if you don't still have that concave, then you're pushing into the ligaments and tendons. And if you stretch a ligament or tendon because they don't have hardly any blood flow, that's why they're white and not red. So muscles have a lot of blood flow. Tendons and ligaments don't. Once you overstretch that part of the body, you cannot come out of it. You can't come back. So in studio, we end up working with a lot of yoga instructors who have been teaching yoga for a long time. And instead of setting themselves up properly when they're explaining how they want their students to do an exercise, they do what I call imitate yoga. So it looks like they're doing yoga, but they're not doing yoga, because even in yoga, a good teacher will never let their students hyperextend into their joints. We do see it. We see it in the Pilates studio, and I guarantee you would see it in the yoga studio as well. But by letting people do that, then they're not receiving the feedback because our proprioceptors are in the joints and ligaments. So the body is not receiving feedback to know how to switch the muscles on how to switch the muscles on, like, at what tension. And if you keep hyperextending through joints, then it can cause long-term pain because it messes with the nervous system. Those ligaments and tendons are not meant to be overstretched. So EDS and HSD, they are both connective tissue disorders that are basically genetic. So some people are born with these hypermobile joints, and EDS in particular is a hypermobility. It's a systemic hypermobility. So that means that it's not just the ligaments and tendons, it's not just the joints, but it's their entire system. So all of their connective tissue has this collapsing structure to it. It's like the fascia within the body. And if we think of the body is like a fascial matrix. So remember fascia, I almost think of it, you could think of it like a web, like a cobweb, but it's 3D cobweb that the entire body is made up of. And fascia is part of our organs within and on the outside of our organs. It's like the glue that holds the body together. So if you think of everything having clag glue above it, around it, and within it, then that's your fascia. When you have EDS, then that glue that holds you together, but also that almost lifts us up, then it is collapsing in the body. So there's too much looseness in that fascia, and that's going to end up affecting the digestive system. It can affect the heart. And actually, people with EDS who have been diagnosed, their average lifespan is like 48 or 50 years old. So they're not expected to have a long life. Now, having said that, the sooner somebody gets diagnosed, then the better they can become equipped at living with something. So it doesn't necessarily mean that that's when that person is going to live until. Early diagnosis and early strategies to help these people definitely plays a role in them living a happier, healthier, and less painful lifestyle. But it is a hereditary disorder or syndrome. Same with HSD, so same with hypermobility syndrome. So sometimes we see hypermobility in the studio, but it doesn't mean that these people have EDS or HSD. But encouraging hypermobility of the joints or laxicity of the joints can lead to long-term pain. And these people with EDS or HSD, they're at the extreme end of that experience, but it is up to us as Pilates instructors and educators to make sure that everybody in the studio is working within their joint and muscle capacity and not overstretching things. Now, there is officially some tests that people get done to find out if they in fact do have EDS. And there's a scoring system called the Baton scoring system. So you could do this now on your own if you want. So there is the fifth finger, pinkies. So if you need to test both sides. So if you rest the palm of your hand and forearm on a flat surface, so you could just pop it on the desk in front of you. So your palm is face down and your fingers are out straight. So you've got your entire palm and your fingers out straight on the desk, and your entire forearm is on the desk. And then you want to see if you could bend your pinky finger, so that's your fifth finger. You want to lift it to the ceiling and see how far upwards and back towards the knuckle you can go. And if that pinky finger goes beyond 90 degrees, then we're going to do further tests and decide whether or not you may be hypermobile. So it's normal if that finger can go up straight up, that's normal, but you've got to be able to keep all of your other fingers down on the desk. But if you can go further back than straight up to the ceiling, so further back than 90 degrees, then that's a hypermobile joint. And don't push into it anymore, just recognize it and then leave it alone. Then there's also the thumb test, and you want to do that on both hands because sometimes we could be hypermobile in one or two joints or some joints, but EDS is systemic. So this is something that you're going to have throughout your entire body. So the test that you do on your thumbs is almost the opposite. So if you, again, test both sides, so extend your arm out straight with the palm facing down towards the floor, and the wrist then bent fully forward. So your fingertips then are facing the floor, and then hold onto your thumb and just see, can you push that thumb back and touch your forearm? I mean, that's a heck of a long way to go, but believe it or not, some people can do it. If you've got EDS or if you've got hypermobility in that joint, then you may be able to do that. So pulling the thumb right back to the forearm. The other one that we look at is the knees. Now, again, we test both sides. So while standing, and this is something that we see a lot in the studio, I am hypermobile in my knees, but while you're standing, with your knees fully straight, so they're locked, bend them backwards as far as possible. And if the lower part of the leg extends more than 10 degrees forwards than the back of the leg, then that's hypermobility of the knee joint. The next one we look at is the elbows. So again, testing both sides. If you extend your arm out to a T and your palm is facing upwards, then have a look at that elbow, similar to what we did when you extended your arms in front of your body. Have a look at the elbow, and does it bend upwards more than 10 degrees beyond the normal outstretched position? So somebody who is hypermobile in the elbow, then instead of having a concave in that elbow joint with the palm facing the ceiling, that elbow joint is going to be pressing up to the ceiling. So that's hypermobility, but above 10 degrees is considered hypermobile. The last one of the Baton scoring system is the spine. So now we get the person standing on 2 feet to do a forward bend. So like a roll down or a fold over in yoga. So you bend forwards and place the palms of your hands flat on the floor in front of your feet without bending the knees. If you can do that, and your legs are vertical, so the hips are vertical up over the ankles, then you may be hypermobile through the hips. So these are the 5 major joints that we look at as far as EDS. Now, the thing is, these types of diagnoses can take years and years for people to finally find. I mean, that's not uncommon. We see that all the time in the health industry, that people live in pain, discomfort, without answers for a long, long time before they find out what it is that they've actually got. So this is just one way of testing for EDS, and you would get that done with a specialist, with a physio, or even somebody who works with arthritis, so a rheumatologist. And you can also, because EDS is genetic and there are some really rare forms of EDS, you can also get blood tests to find out if you have some of the rarer forms, because they can really have a huge effect on your organs as well. So basically, patients with EDS, they have inherited flaws of function. So they lack strength and structure within their collagen. So our body is made up of collagens, and collagen is an important protein that provides structural support. So it provides support in our blood vessels, ligaments, skin, cartilage, tendons, and organs. So if you've got EDS, then your blood vessels may collapse, your ligaments would be overstretched. So that was the Baton test that we just did. Your skin can look really, really smooth and supple, almost translucent. But if you get a cut, because your collagen makeup is not as structurally sound, then it can take a long time for things to heal. And then because of that, you could be more susceptible to infections. Your cartilage doesn't have the same structural support, so can injure much easier in the joints. Tendons, which I've already said, tendons don't have a lot of blood supply. So if those tendons are overstretched or they're not composed of capable fascia, then those tendons tend to have a lot of laxicity in them and also prone to injury. And then, of course, your organs, if your organs don't have enough structure, enough almost space between them and enough lift in the body, then your organs really come a strife. So we're thinking bowel issues, digestive issues, organs literally collapsing on each other. So we know of people, we've worked with people in the studio with EDS who have spent a lot of time in hospital with a lot of these issues. So it really can affect somebody's life so badly. And unfortunately, because things are quite often not diagnosed until later on, once things start to collapse in the body, so once these systems start to collapse and shut down or not work well, it's very hard to then find formation for them again. But our job in the studio is literally to help these people find strength, to create space in the joints, and for them to be able to live and support their body in movement. Things that we're going to see in the studio with people with EDS or HSD are basically chronic fatigue is very, very common. The body that is not supported, the body that is collapsing, is constantly working. So if you could imagine that you never, ever get to sleep, you're constantly walking on a small incline every day, all day long, 24/7, it would be exhausting. So the body of somebody who has extreme hypermobility or EDS is constantly working to support themselves. They never get to rest. So they end up with chronic fatigue, anxiety. Because of that, the body is completely stressed all the time, anticipating things going wrong. So the body is always in fight or flight. So even though the body doesn't structurally have support, it collapses in on itself, it has a lot of tension because the body is under stress all the time. And if you go back and listen to my podcast about stress, then I do talk about the physicality of stress. So people with extreme hypermobility, EDS, do tend to live with anxiety and high stress all the time because their body is always in this anticipatory level of excessive, trying to help itself all the time. Digestive issues, I've already said, bowel issues, which could also be IBS, so irritable bowel syndrome. Migraines is a big one. So imagine what would happen if this was systemic, so your collagen doesn't have the makeup or your fascia doesn't have the makeup to support itself. And our whole life is really about our relationship with gravity. So we're standing on 2 feet or sitting most of the time, but if your system isn't able to work against gravity. So if you don't have the collagen makeup, the fascial makeup to keep space between your bones, your head on its own is like 10 pounds. It's heavy. So then those neck bones and those neck muscles end up collapsing. And when they collapse, and even the fascia around your brain, around your skull, doesn't have enough space, enough support, then you end up with headaches. So not just headaches, but migraines. Quite often with somebody with EDS, it can be that those very top cervical bones, so the atlas, so right where the skull sits on the very, very top of the spine, it has too much transverse movement, so it ends up doing what's called shearing. So if you pop one hand on top of the other one and you just move one hand in one direction, the other hand in the other direction, that's a shearing effect. If there's too much of that in the neck, especially because those bones, they don't have a lot of space between them. So all spine bones, all bones in the spine, all vertebra, I should have said, they have discs in between them. But in your cervical, you don't have very big discs at all. They're very, very thin because the neck really is designed to rotate from side to side so that we can look side to side. But if you don't have good connective tissue around the neck to support it, then anytime you look down, and especially when you look up, then those bones will slip on each other as well. What should happen when we look up, and this is something that we teach somebody with HSD or EDS in the studio, is if you're sitting there or standing, I want you to imagine that your head is like a helium balloon. So as your head fills with helium, you can sense that your head is gently getting pulled away from your shoulders. And as that helium takes your head up towards the towards the sky, I want you to get a sense of the space between the bones of the neck. Now, somebody with EDS or HSD doesn't necessarily have that space. So if we can do things to help formulate strategies and images for them to create that space in their neck, then when they go to look up or down, those bones are not sharing. Now, the reality of it is, in a studio situation, I don't get those people to practice any type of looking up to the ceiling anyway. What I teach them is how to use their thoracic spine, so the spine around their rib cage, to go into extension instead, because of that idea, especially if they tell me that they suffer from migraines. It's one of the key things that I'm listening for is, what is it that you're suffering from? So, what are the symptoms of your experience? Because everybody is so different, but I'm always asking things about what's happening in the neck, what's happening in the head, to give me ideas of what I can do to help. Now, interestingly, autism, ADHD, ADD, and Tourette's are all associated with EDS and HSD. So it's very, very common with people with any of these syndromes to also have hypermobility, which I just think is quite interesting. So ultimately, it affects the nervous system. Now, there are really three cardinal features of EDS. And so EDS, it's a term for a group of relatively rare genetic disorders of connective tissue that are characterized by skin hyperextensibility, so very flexible skin, paper-thin, translucent skin, joint hypermobility, and tissue fragility in general. So remember, we're thinking of all of this as fascia. So some things that these people are really struggling with is proprioception. So proprioception, there's these common types of proprioceptors. So proprioceptors, they live in muscle spindles, in the Golgi tendon organs. So they are the junction between the muscles and the tendons, in our joints, in our vestibular system, and in the skin. Now, when we're moving, we have a lot of proprioceptors in our hands and our feet and our face. And partly that's because, if you understand anatomy, we have a lot of bones especially in the hands and the feet. So don't quote me on this, but each foot, one foot, has something to the effect of 30 odd bones or 28 bones and 33 joints, around about. So there's over 100 tendons, ligaments, and muscles in each foot. So then that transpires to a heck of a lot of proprioceptors as well. This is normal, like this makes sense if you think, so our proprioception is our understanding of where we are in space. So because we use our hands and we use our feet to pretty much do everything in life, both to walk around in life, to pick everything up, we need a lot of proprioceptors letting us know where our hands and feet are. We also have a lot of proprioceptors in our face, which is why when we, and interoceptors in our face, which is why when we kiss somebody, we get all those fuzzy feelings. So exercises that can help us improve proprioception. So people with EDS, with HSD, they don't necessarily have good proprioception because of the tissue makeup, because of the connective tissue not being strong enough or being too stretchy. So things that we can do with these people in studio are balance exercises. So practicing standing on one leg is really important. So if we translate that to reformer exercises, anything like single standing leg, so thinking scooters, you could also be doing the splits, standing on the carriage, but also considering that they don't have good proprioception. So important probably to have them standing and holding onto something. So you could have them, say for example on the reformer, have their hands on the foot bar. Quite often I'll use a broomstick handle and get them to hold both hands onto the broomstick and press that broomstick down into the ground, partly because that really gets the whole upper body working as well. Now, things that improve lower limb proprioception is super, super important. So really you could think any of your footwork, sideline glutes, any of the standing stuff, simply because we get around life on our feet. So we want to make sure that anyone and everyone is strong in the lower limb. What we're looking at when we're working with EDS, HSD, but also with hypermobility in general, so they might not be diagnosed, but we can see that they're hyperextending through their joints. We want to make sure that everybody in this class is in good joint alignment because of these proprioceptors. So remember, our proprioceptors, they live between the muscle and the tendon. So good joint alignment means that those proprioceptors are working well, and then our understanding of where our body is in space is improved, and the muscles are working better to support the joints and almost lift the joints up away from each other, create what I think of as space between the joints. That can only happen when you're in good joint alignment. So making sure that people are not hyperextending through the back of the knee, not hyperextending through the ankle joint even, not hyperextending through the hips when they're exercising is very, very important. So really we're thinking of joint repositioning training for these people in general, with an understanding that there's a tendency for them to collapse. So while we do want to be working towards progressive load, I do tend to spend a lot of time just getting them to feel their body using their own body weight and creating a sense of space in the joints and a sense of solid foundation as well. Using different textures can be really, really great. So we use a lot of chi balls, magic circles, therabands, squishy balls for people's hands. Even you can get like this physio Play-Doh. So anything that gives sensory feedback is going to be fantastic because they can't necessarily get a sense of where they are in space. So using props rather than open chain. So remember, open chain is, say if I've got my arms there in front of me and I'm just holding my arms forwards, that's open chain. And maybe I could just be taking my arms from in front of me out to a T back in front of me. That's open chain. It's common what you'll see when somebody has laxicity in the joints and no feedback is, remember that test that we did to have a look at hypermobility through the elbows. Well, they'll also quite often have the hypermobility in the shoulder joint. So if I cue somebody to take their arms from out in front of them to a T, somebody with poor proprioception, they go way behind their body. They can no longer see their fingers in their peripheral vision, and now they're stretching out the ligaments and tendons and hyperextending through the shoulder. So I make sure, that say if you're on a reformer and you've got hands in straps, say you're doing seated arms, seated on the long box, as you take your arms out towards a T, you only go to where you could still see your fingers in your peripheral, which means that you're not turning your head at all. You're turning your eyeballs side to side and you can definitely see your fingers. That's as far as what you should be going. And that applies for everybody in the studio, and we see it all the time where people go way too far back. We know then that they're just stretching out tendons, ligaments. There's no good end result to that, but especially for people who don't have the body feedback. Now, the springs or the straps themselves can give the body feedback. Just check in that they're not hyperextending through the elbow as well. But coming back to what I was saying, by using balls and magic circles, it can be really great for these people to visually connect with a ball or a magic circle, have the arms extended out in front of them and be squeezing that now. So now they're getting a lot of sensory feedback, both from the eyes and from the hands. Always checking, absolutely, are the arms correctly placed in the socket of the shoulder joint? So if our arms are extended out in front of us, we are not rounding the shoulders. So we're not pushing the arms away from the sockets. There's a sense of almost sucking the arms back into the sockets. So there's this constant push-pull. You're pushing into the magic circle, but at the same time pulling the arms into the arm sockets to keep that connection. Because people with excessive hypermobility or EDS, they don't necessarily feel that. So we spend a lot of time teaching them how to set up for correct joint placement, and that is part of their strength training. Because otherwise, if you don't get the joints right, if you don't get all of that proprioception correct and improve on it for them, with them, then they're just going to keep collapsing into joints. And when we collapse into joints, similar to like when I was looking up to the ceiling and I'm shearing through the cervical joint, if my arms are collapsing into my shoulders, then I'm also shearing against the shoulder joint. We're trying to create space all the time. So that's proprioception. But they also struggle with what's called interoception. So interoception is, there's 7 senses of interoception. So with interoception, you know if you're hungry, you know if you're full, you know if you're hot or cold, you know if you're thirsty, you know if you feel nauseated, if you're itchy or if you're ticklish. So people who don't have good interoception, they don't necessarily feel these things. And so it's really, really important that we practice interoception exercises and activities as well. So again, chi balls, massage balls, squeezy balls, magic circles, TheraBands, and the machines all give the interoception as well. Interoception is a part of when you're on a reformer, say if you're doing your footwork, you can actively feel your leg muscles pushing the carriage out, but then we want you to actively resist the carriage back in as well. So as you resist the carriage back in, it's your muscles doing the work, so you're never riding the springs at the same time as maintaining good joint alignment. So the pelvis is staying nice and steady, back of the pelvis wide on the machine. And as you bend the knees and come back in, when you get that sense of resisting the machine in, then you can feel the space of the femur bones in the hip joint. So you're not jamming up against those joints. So we want to be practicing things with these people, like feeling the stretch. It's not actually a stretch. It's actually feeling the eccentric control of muscle and feeling the concentric control of muscle, and making sure that they're not overexerting into those joints, and feeling that resistance, and also learning how to breathe well. So something as simple as a deep breathing exercise can help these guys really tap into those interoceptions or interoceptive practicalities. So spending time with them, helping them to relax. And, I know that can seem a little bit like is it an oxymoron? Like they come in and they're super mobile, right? They're hypermobile people. So you would think that they don't need to relax because they're already too relaxed. But in fact, remember I did say at the start of the show that they suffer stress, high stress and anxiety, because the body is constantly turned on trying to support them. And so they get very, very tired. And it's important for us in the studio to take time to help them just settle into their session. So when I'm working with somebody with excessive hypermobility or EDS, then I definitely start the session with some laying on your back in a comfortable position, normally either with your legs over a fit ball or over the short box, over some cushions for support. I usually use a half deflated chi ball underneath the skull. So that just acts like a little half coconut that they place their head in. And we practice some deep breathing techniques, really expanding through the belly, expanding through the rib cage, and then allowing for everything just to fall away and relax. Partly what happens when we lay on the back is it changes the relationship to gravity. So if you don't have the structural support to lift your spine up out of itself in standing, and it's constantly collapsing in on itself and your organs as well, then laying on the back quite often can just allow for that little bit of space, almost a feeling, a little bit of traction feeling. Now, depending on the person, sometimes I do put people in traction, but I'm working with the person, and every person is so different. Their experience is so individualized that we figure that out together as we go. Now, we need to really take that into account, that the stress and anxiety of people living with this chronic illness or with any chronic illness, and plus the fear of like constantly attending medical appointments and, people who live with these types of things, A, it's taken them forever to figure out what it is that they've got. B, it's what they've got is it's invisible, so that's part of the reason that it takes so long to get diagnosed. They go to their GP with these random signs and symptoms. They're told that it could be arthritis. They're told that it could be IBS, which IBS on its own takes 100 years to get diagnosed, but you don't look like you've got anything wrong. So I was working with a client 2 nights ago, and she has EDS, young girl, or younger than me, so she must be young, and she's an ex-gymnast. Now, this can be common. If your parents do not realize that what you've got is a chronic illness, then sometimes we are exposed to and encouraged to really push into this hypermobility. So she's lived with chronic pain for a long, long time. But when she was a kid, she used to do gymnastics because she was super bendy. So not everybody who is super bendy has a problem. But if it causes you pain, but she didn't realize that the pain that she was in was not normal because she kept getting championed for doing what she was doing. But to look at her, because she has spent a lot of time training over her life, to look at her, she looks like a fit, active person. But she can't pick up an apple without her entire body going into spasm. So she lives with such chronic pain and fatigue, but it's completely invisible to other people. So she said that when she goes to the GP and the GP tells her that she's lucky that she doesn't have any limbs missing. Well, that's not what somebody who lives in chronic pain needs to hear. What they need to hear is an ear of somebody who has empathy and understanding of the way that they're feeling and then wants to strategize with them so that they can live better. Nobody wants to hear from somebody that they perceive as an expert that they should be grateful. It just doesn't make sense. But she doesn't look to be sick. Blood tests, MRIs, and other diagnostic tests, they often come back clear. So then the symptoms are dismissed. People are told that there's nothing wrong, but it doesn't change the fact that you feel unwell. So, knowing that you're not alone and that you can still take action on things can really help alleviate people's pain. So you don't need to understand exactly what the person is going through, but you do need to be willing to listen to them, willing to create a safe space for them. Now, we don't work in like a group reformer class with these people. We do work in a semi-private or on a one-on-one. And quite often when they first start out, they've only got about 30 minutes of challenge in them. And then we work towards going to an hour, but even once we get to the hour, then quite often a lot of that time is spent, or 15, 20 minutes of that time is spent on meditation and breathing. So they may not have the endurance that somebody else is going to have. These people get told that they're too young to have this much pain. So, hormonal changes in puberty can often be responsible for the onset of symptomatic hypermobility. And both EDS and HSD cause a heck of a lot of pain. And the pain is actually one of the first symptoms to present itself. So there is no too young. Normally, or it's normal, as you start, normally it's women tend to have these syndromes much more than men, but it can come about once you start menstruating, and it can really play havoc once you go through menopause as well, because then your body's not producing the estrogen, progesterone, and testosterone to support your body. So every woman going through menopause, her body is, for better words, breaking down. So somebody who is already living with a system that is struggling to support them, then they can really suffer a lot of pain. A lot of people will tell your client that there's no cure for EDS or HSD, but there's actually heaps of things that they can be doing to manage the condition and improve quality of life. And the beauty of it is Pilates is one of the best things for these people, because we are always looking at better joint placement, better postural changes, and we're able to support them without loading up too much, but giving them enough load to give them feedback. Now, sometimes, when we did that little test, the Baton test, now that score, it measures joint hypermobility, but it only looks at a few joints in the body. So it really doesn't give a full picture of the hypermobile body. And remember, this hypermobility can be in the organs as well. So just because somebody has a low score, it doesn't mean that they're not hypermobile. So they don't have to have all five, but it's an indicator. It gives us a little bit more information. And not everyone who is hypermobile has all of these symptoms. So, there's a difference between hypermobility and instability. So somebody who has EDS or extreme hypermobility, then they are seen to be unstable as well. So for example, if you look at circus performers, professional dancers, and a lot of athletes, they can be hypermobile, but then it's not causing them any pain. So they still have a lot of stability through their joints. So let's not confuse instability and hypermobility, right? So you can be hypermobile, but not have EDS or HSD, right? And you can still be performing everything fine and not be in pain. That's okay. So instability is when you do not have control and it's coupled with this loose connective tissue. So a hypermobile joint is one that has laxicity in the ligaments and loose fascia, which causes the whole system to collapse. This is where the pain is. So you could also have just instability. So instability could be coupled with global tightness. So quite often we will work with people who do a lot of heavy loading at the gym. So they have these beautiful, big global muscles, but then we get them to do something really simple, or what we perceive as simple in the Pilates studio, like splits on the reformer or even scooter, and their pelvis is all over the place, and we can see that they are unstable. So they have instability. What happens with them is they have these global muscle strength and these tight muscles that are global, but then they end up having a weakness or fatigue of the stabilizers, which then we can see as instability. So then we want to work on intrinsic strength for those people. So I kind of look at people in those three different ways. So you could be hypermobile, but still functional. You could have instability, but still be strong, or you could have hypermobility and instability. And that's really what is the concern, is when you have both of those things together, you don't have any support at all. Very, very important. Now, I think that's about it. Let me have a quick think. So we've talked about lack of postural tone, right? So we're looking at whole body organization. We're looking at helping people move away from bracing patterns. So because this instability and hypermobility is both present, people with EDS and HSD are expending a heck of a lot of energy, which both gives them fatigue, but also can interfere with their breathing. So we want to be teaching breathing, deep breathing. Of course, stress and anxiety of living with chronic illness is a thing. So ultimately, some things that we want to consider. So pretty much like the top things that I want you to take away. Don't force it. Movement is key. And in fact, if somebody with EDS or HSD is sitting for 8 hours a day, their whole body is just collapsing in on itself. The best thing they can do is get up and do what you could think of as exercise snacks. So little bits of exercise throughout the day. If you need to sit down, then sit down for an hour or so, get some work done, but then get up, reorganize yourself, reinvigorate the body, make sure that you are well hydrated, because the glue of your body, the fascia of your body, demands hydration. So well hydrated, a very good diet with good fats and all of the healthy stuff, but definitely don't force it. So what happens is if you force things, so if you're forcing your body to exercise or move too much, it's going to increase the stress. So your body is only going to get tighter and tenser. So learning to listen to your body and adopting this attitude of rather than no pain, no gain, which was created by some idiot who doesn't have a brain, we should be thinking no pain, no strain. So approach this to allow your fascia to move freely and smoothly, and think of your fascia almost like gliding, so you're not going to be tightening. Work on relaxing your mind, so definitely integrating some meditation techniques and breathing work. We're all busy, right? But remember, the EDS, HSD people, they're working overtime all the time. Keep moving, so don't force the body, but don't stop moving altogether. So by moving, you're actually rehydrating the fascia, and that's what it needs to maintain its suppleness. Be patient. Be patient, my friends. Normally, by the time somebody with EDS or HSD comes to the studio, they have been everywhere in the world and nothing has helped. And so what the heck have I got to lose? I'm just going to try Pilates. That's the reality. This is when we see these people. So their road has been long, lonely, full of misconceptions and silly attitudes. So when they get to us, we need to really be helping them move forward. So be patient. Things can be moved, fascia can be rehydrated, the body can be strengthened, but it's not going to happen overnight. What we're thinking is, what can we do to support you for the rest of your life? And that means giving homework. So 15 minutes of homework every single day. The reality of working with these syndromes is that these people do have to cancel with you, because sometimes they're just not able to get into the studio. Sometimes they do spend a lot of time in hospital as well. So give them things that they can be using every day, no matter where they are. Keep working with these people. They really do need us. Sing out if you have any questions at all. Isn't the body just fascinating? I mean, every week when I think about what I'm going to bring to you, it's almost I can't even choose a topic, because there's so many intricacies of the body. And we are individual beings. We are all here having a collective experience in our very own temple of a body. Isn't it a beautiful thing? Thanks so much for joining me. I didn't even promote my teacher training to you today, but remember, that's what I do. Pilates Pro Academy, 6-month training program to become certified as a reformer instructor that is recognized and recommended by the Pilates Alliance of Pilates Association of Australia. Love you guys. I know you've changed your name recently. If you're interested, sing out to me. Definitely join me on the Pilates Muse, because not only do I love talking to you, I adore writing about these things as well. I can't wait for you to join me next Wednesday for the next episode of the Pilates Lounge. My name's Katie Crane, and I am the Pilates professional. Have a wonderful week, my friends. Goodbye.